Good morning. My name is Renee Herman, and I am a breast cancer nurse navigator. I wanted to thank you for allowing me the privilege of sharing with you today. I guess the first thing I want to say to you is I'm sorry. Some of you need to hear that. You need to hear that you are some of the few who are overlooked. You are some of the people that did not get access and had barriers, and nobody was there to help you. But I'm here to tell you that it's changing. There are a lot of healthcare providers right now who've been made aware of what's going on, and we want to be there for you. I wanted to start today by talking about nurse navigation. An important part of your team, I hope that you had, and if you didn't, that's what I'm here to help you understand, is that this nurse navigator, I hope, is like a GPS on your journey to help guide you through so that you don't feel alone. So I have a definition up here. An oncology nurse navigator is a professional RN with oncology-specific knowledge who offers individualized assistance to patients, families, and caregivers to help overcome healthcare system barriers. So one of the things that I wanted to just let you know is that this is a fairly new position. In 1989, the American Cancer Society's National Hearing on Cancer in the Poor highlighted significant barriers by low-income individuals. Dr. Harold Freeman in 1990 launched the first patient navigation program in Harlem Hospital in New York. And his focus was on eliminating barriers and improving cancer outcomes. Some of these care objectives in patient navigation include, and I want you to think about this whole group of men who have breast cancer in this. Addressing barriers. We have aims to eliminate financial, logistical, and communication barriers that prevent individuals from accessing timely cancer screening, diagnosis, and treatment. We are here to improve access. The goal is providing personalized support and guidance to help patients navigate through this often complex healthcare system and receive the care they need. The third thing is to reduce disparities, facilitating timely access to care so that we can improve cancer outcomes, including earlier diagnosis, better treatment adherence, and to reduce mortality. So,
Do we need to switch slides?
right now,
Okay,
thanks.
there we go.
So how does a patient nurse navigator who specializes in women's breast cancer from Parker, Colorado, have the privilege of speaking at this conference? Well, in the past 6 years I've been working in Colorado, I've navigated male breast cancer patients probably 1 to 2 a year. In 2024, we had 7 in the Rocky Mountain region. I was at some point given the description of a fierce and relentless patient advocate with a caring heart. So at the same time I'm fighting for you, I can pick up a Kleenex and cry with you. How about that? I was appalled at my lack of knowledge of male breast cancer. And I knew how to sit with a woman for an hour, go through with her and her partner diagrams, next steps, even into survivorship. But I wasn't very comfortable with talking to men about male breast cancer. So I did what any good nurse would do, and I looked online for every accessible article that there was on male breast cancer, through the National Health Institute, through the American Cancer Society, even Susan Komen, who has the Pink Walk. And what I found, not to anybody's surprise, was a wonderful website called Male Breast Cancer Happens. I was so excited. I saw these shirtless men and I thought, okay, we're gonna do this, and I'm gonna be the supporter for my male breast cancer patients. I picked up the phone And as already been said, Peggy Miller actually answered it. And I said to her, this is who I am, this is what I want to do. And she said, great, we've got information for you. How soon can we meet? I said, well, I'm in Parker, Colorado. She said, well, how can you get to Kansas? I said, I have family in Kansas. She said, I'm in Prairie Village. I said, I'm in Overland Park. And so we met, and true to form, they invited their family over. My husband and I came, and we had mama burgers. And you know what? I began to listen, not only with my ears, but also with my heart. And I began to realize that I'd worked for all these years to prevent people from not having access, to overcome barriers. And there was a group of men out there who were sadly forgotten. And I'm here to tell you that on my watch, we're doing everything we can to educate providers and to provide what you need. And you keep teaching me, and I'll keep supporting you. Okay? All right. You are not alone. Isn't that the theme of this conference? And I want you to know from this healthcare professional, you are not alone. I'll get the next slide. Oh, yeah, is the next slide coming? Oh, okay.
Wrong way.
There we go. There we go. There we go. I wanted to give you just a little bit of an understanding. Oh, thank you. Oh, now I have it.
Yeah, you can throw me on.
Okay. I wanted to give you just a little understanding of the flow of events that happens in our particular clinic at the Advent Health Parker Breast Care Center. So at where I am, we typically get the pathology reports after you've had a biopsy. So by then you've already been screened, you've already had your clinical exam usually, a lump has been found, you've gone through all this business ahead of time. And so this is where I step in. I do want to say, however, that because of what we've been doing to increase our understanding of male breast cancer, we've been giving out the exam cards, self-exam cards. They're available in our breast care clinic now. Our screeners there are aware that we will have men, and we are trying very hard to stock our blue gowns instead of pink gowns so that you're not having to walk through in a pink outfit. We don't want you to have shame in this. There's no shame. There's no shame in having diabetes. There's no shame in having COPD. There's no shame in having asthma. There's no shame in having a stroke. And the blame that continues to be on people who have cancer is just unfathomable to me. You didn't choose this. And so it's a path that we're here with you to walk through, that I want you to remember. We want to make it as easy as we can, but we also have to be a little educated, okay? So there's the screening. The diagnostic breast care is where I come in with the pathology report. So those of you who've already been through can imagine what this is like, but I'm going to give those of you who don't know what this is like a little clue. I pick up the phone. It rings, somebody answers, and I say, is this Brett Miller? Yes. Can you tell me your date of birth? This is Renee. I'm a nurse navigator, and I have your biopsy results. Now I'll tell you with a woman what happens most of the time. I'll say to them, would you like somebody on the phone with you? And they say, honey, come on up here, or partner, come on up here. And they put me on speakerphone. Often with the men, it's a little different. They want to hear by themselves. So I'm there, and I say, I'm calling about your breast cancer, or breast biopsy diagnosis, and it is breast cancer. Usually there's silence for a few minutes, and I say, I'm the nurse navigator, and I'm here to help you through it. This is treatable. And I want you to hear that. It is treatable. And what you've heard is a very difficult, challenging journey. But we are aiming to make it treatable for everyone. Okay? I tell people there's 3 things in treating breast cancer. The first thing is to get a good diagnosis. And getting a biopsy pathology is only a part of it. We get prognostic indicators. You've heard about ER, PR, Ki-67. You've heard about a lot of things that we get along the way. The second thing is that we usually get you to the surgeon as the first form of treatment or the primary to get it cut out. And the third thing is we get you to a medical oncologist to then decide what adjuvant or neoadjuvant. Adjuvant is treatment in addition to surgery, whether it's before, with some people have chemotherapy before, some have after, some have radiation afterwards. Most have endocrine therapy, which is your AIs, your inhibitors. So there's a lot going on. But beyond the active treatment, then, we go into survivorship. We call you a survivor from the get-go. And survivorship has to do, I think, with that whole part of this journey. When one day you wake up and you realize you've rung the bell, right? Chemotherapy is over, radiation may be over, and you say to yourself, now what? Here I've been worrying about all these appointments, the inconvenience of it, the cost of it, the fatigue level, what my family's going through, and you just said I graduated. What does that mean? And so we're going to talk a little bit about that. One of the things I did want to show you is that in our program particularly, I have a folder that I give people with resources. And I'll go to the next slide here.
Press the down button.
Press the down button. Okay.
We'll point here.
I'll
at
point
me.
to the,
Oh, it was working.
Oh,
there we go.
let's go back.
There
Oops. Cool.
There we
you
go.
I'm a nurse. I am not technology.
Nobody's perfect.
Okay, here we go. So a couple things. I usually call and say to people, you know what? You're going to make all these appointments and we're going to help you set them up. But I would like to see you, and I can offer you an hour, which sounds like a long time, right? And I'm free of charge at this point. You can sit with me. I'd love to meet with you, and I'd love to give you some education or resources to support your journey. So as we sit down, one of the things that I found that I would recommend to you that has worked out to be so helpful is the Male Breast Cancer Treatment Handbook. And I don't know if any of you received this, but this is a gold mine of information for men. I have a copy up here. I have a copy here. I'm going to leave one with Brett and with Peggy. And I just want you to know that there are resources out there. This one happens to be by Judy C. Niche. She's an RN with an oncology certification. And she did what we use for our women's book. But this one actually has pictures of, ta-da, men. This actually shows you surgical decisions that can be made. It goes on, the table of contents is amazing. It is your breast cancer diagnosis, talking about your diagnosis, communication with your treatment team, male breast cancer surgical treatment, male breast reconstruction. It goes on to say the pathology report, chemotherapy, radiation, the stress of cancer, anxiety and depression, complementary and alternative medicine, sexuality during and after cancer treatment. How many of your nurse navigators have chatted with you about that? Diet and exercise, health insurance, employment issues, monitoring your future health for recurrence, facing the future, and so much more. So I would highly recommend this, and this might help you on your journey. So we do try to give that to our patients, along with a lot of handouts. One of them is an oncology support services guide that tells our patients what we have available to them where we are. I also give them a breast cancer related lymphedema checklist. We work with our physical therapy to do pre-op evaluations to have a baseline measurement for lymphedema. And then I also give this to them and I say, this could occur even 5 to 10 years after your surgery. So I want you to keep this in a place where if you begin to realize your watch or your rings are beginning to be tight, you look at this and you run to your doctor. Because the earlier we can treat it, the better the outcome. We have God's promises. I guarantee you that at some point on your journey, you're going to look back to your childhood faith, you're going to seek out a faith base, or you're going to cling to the anchor of what you have. These happen to be little ones we give. We're a faith-based hospital, so I have a lot of these little booklets. I have a lot of my patients who put them in their pockets, they take them with them, and on those dark moments, they find some light. I also remind them that there may be times of freaking out, and it's okay. It's a stressful diagnosis and a stressful journey, and if you need some mental health help, we're here to do that. One of the things that we are starting and trying to do right now is we have a psychologist that I found who actually is very helpful to our patients. And one of the things that she does is talks to them about the loss and the grief of going through this diagnosis. We are now in the midst of planning a caregivers conference so that we can have partners and patients, husbands and wives, mothers and sons come. And what we're trying to do then is we're going to meet together, then we're going to split up, and we're going to give the caregivers some TLC and an opportunity for them to share with one another what this journey's been like. We also now partner with a cardio-oncology clinic for our chemotherapy patients because you know of the toxicities that happen. We have a naturopath on our staff. Sometimes our patients want to go to a naturopath because of all of the side effects. Sometimes there are natural things that can be done. So I give this. I also give them some examples of things that the community, and I'm very, very aware and make myself even more aware of what's available in the community. For those with kids, there's a wonderful book by the cancer support community called What Do I Tell the Kids? An exceptional guide that tells you what your kids may be going through at any age that they're there. How do we talk about this as a family? I have a whole list, and I've purchased many books for children on parents with breast cancer. Right now, if any of you are writers, we have several for mothers, but we don't have any for daddies. So that would be a good one. We have a kids organization. We have Sights and Insights. I have that there. You can get online and do some art. She doesn't call it therapy, but it does work that way. Campfires of Hope through Epic Experience. They actually have virtual goggles. They have outdoor activities like rafting. And then there are so many other examples of what, for instance, the American Cancer Society has in many different languages as well. The reason why I show this, oh, and one of my favorite, triagecancer.org, which talks about the financial burden and things you can do. Why I show this is because my hope for you is that your navigators, I hope, are giving you resources that are going to last beyond just the treatment. Along with this, and you all know Dr. Lopa, recently I've been working very diligently to try to get our patients aware of some of the resources available, get them aware of male breast cancer as well. One of our local disc jockeys who is just retired, Murphy Houston, has had male breast cancer. He's known to this group, and his wife has now had breast cancer twice. So we are looking to have him to come speak to the group as well. We had Brett, Dr. Lopa, and Murphy Houston speak to our group on a Zoom meeting so that our providers could begin to understand the magnitude of what a man goes through. I'm going to have to remember that I have my things here. So we got connected with Dr. Lopa at the breast cancer hub, and she helped us to get some pillows for men. A lot of the pillows that we give to our survivors are pink, right? So she helped us get some materials that are amazing. I have golfers, I have bowlers, and this goes under your arm, and you can put a little ice pack in it. So the ice pack can come along here under your arm. This is also a port pillow that you can put on the seat belt so that you have something that keeps cushioned when you're driving or a patient in the car. And she actually then made some very cute little hats. I think, oh, here it is, that are extremely soft material, because you know what that's like on your head to even wear a rough feeling hat. So I'm very appreciative that they were able to give us some of these to give to our patients. In addition, we give all of our patients a blanket. And normally we give a blanket with a ribbon on it, a white one. But we found an organization that's willing to help us. This happens to be a purple one, but I have a lot of blue ones and red ones now. This is a Christ Warrior blanket, and it's very nice. It opens. But you know what? This is perfect for chemotherapy. You can cuddle up in it when you get cold sitting in the chair. But along with that, it's prayed over, and people are reminded that they're not alone. Okay, so this way.
Supposed to.
Is this?
Want
That
to?
one?
No, technology's not you.
Okay.
There
Do
we
it
go.
again.
I got it.
Okay, I wanted to just make you aware of this phrase, social determinants of health. You may hear this from your oncology team, and what this means is that there are disparities in how care is given throughout the U.S. A lot of times it depends on education that people have. We call it health literacy. You can have a PhD in chemistry, but not understand what they're trying to tell you and the words that they're using. Economic stability. We know the burden that cancer puts on us financially, but some people start with a very low poverty level when we first see them. Healthcare access. We want you to have access. And you know, insurance has created a barrier for all of us in some ways. Social and community context, where you live. We deal with a lot of rural people. And so getting in, we try to stack their appointments so that they're not driving 45 minutes or an hour for one appointment one day and then the same the next. And then neighborhood and building environments. What is your transportation like? As part of your team, I want to remind you that you're not alone. There are social workers. There's even through the American Cancer Society people who will help you with house cleaning. And this should be and must be available to men patients as well as women. All right, let's try this again. There we go. I just briefly want to go through the stress cycle. I go through this with my patients a lot because I want to remind you that the stress is real. And if you look at a stress cycle, there's many that I've looked at in books and online. The main event is the cancer diagnosis. That is the same, if you can imagine, the same threat as a car accident, go figure. A death in the family, then you get it again with chemotherapy, radiation, surgery. This is a real stressor. It's like a deer jumping out into the road, which we have a lot in Colorado, or a bear coming out of the woods, but it doesn't go away, right? And so this is something that needs to be dealt with. Your brain's perception has a lot of fear. Physical and emotional signs happen because your body wants to get back to that homeostasis. The autonomic responses then do come to a fight or flight. You're pretty familiar with that. There's times where you just want to give up. You want to go somewhere and you're done. There's a withdrawal that can happen. And if it gets into an exhaustion state where you're so depressed that you can't function, we need to get you help. Please don't go through that alone. But sometimes there's that fight response that says, we're going to do what we need to do. We're going to get the resources we need. And I want to be on your team to help you do that. I do want to give you hope and remind you. See that little light blue box? There are things in your life that have prepared you to do this. If you have a support partner, marriage, if you have a wonderful partner, this will help you through. But you know what else? There are people and resources out there. There are experiences that you've had, a faith base. There are many things that can help you through this, and I want to hang on to that for you and give you some hope. One little fun thing, there is a woman by the name of Marie Cardinal. She started a group called A Little Easier easier recovery. And she's now joined with the Cancer Community Support Network. But she said, create a pass. This is fun, and I love to tell the people who come in together about a pass. It's very simply a pass. It says, just like a hall pass. Remember a hall pass when you needed to leave your classroom? It says a pass on an 8.5 by 11 paper, 2 of them. And this is so you can remind yourself to give yourself a pass. Remember the hangry commercials where somebody gets all bent out of shape? It doesn't get cured with a Snickers bar, right? But give yourself a pass. Give yourself some grace. If your partner or your husband or wife is not right there with you, give them a pass some days. This is difficult for them as well. But also, remind people around you that this cycle is real. And there's going to be days when you're going to explode for no reason, and it's okay. All right? So I just say give yourself kindness and grace the same you give to someone else. I'm sorry.
It chooses when it wants to.
It chooses what it wants to. Okay, there we go. This is what survivorship is. In cancer, survivorship focuses on health and the well-being of the person with cancer from the time of diagnosis until the end of life. This includes the physical, mental, emotional, social, and financial effects of cancer that begin at diagnosis and continue through treatment and beyond. The survivorship experience is a wellness experience. I want you back after you've dealt with cancer, and remember that cancer doesn't just define you. You still need to go back and have your annual physicals. You still need to go back and take care of knees or arthritis in your elbows. And I think that's part of the overwhelming part of survivorship. You're not just dealing with cancer, you're dealing with a lot of other things. But we want to be a team. One of the things we do is a survivorship care plan at the end. A survivorship care plan that I write for our patients puts together some of the dates that are important for them to remember. And then I give resources that help them get back into the community and living life. And then I just want to finish with this. One of the Bible verses that I love is, without a vision, the people perish. And so I feel like part of my job is to bring you hope on this journey. And so this is a picture with all of the things that the Breast Cancer Hub gave us from Dr. Lopa that we're so thankfully giving to other people. But it also reminds me that over and again, there is a wonderful opportunity for you to write your own story. And as you share your experience, don't forget to write it down. There are many magazines now that love patient stories because other people need to know they're not alone. Other people need to know what you found was helpful on your journey. Here's my story. In December of 2023, I was there and I was diagnosed with breast cancer. I was reading my own pathology report, which was a very surreal experience. And I had ductal carcinoma in situ with invasive ductal carcinoma. I got through my surgery, I got through radiation, and then I had a complication of AFib from all the stress. We were going through a lot of difficulties at work with changes, and along with the many personal experiences with our family. If I hadn't had my husband of 40 years to hold me up, to be full of grace when I was a little bit ugly, if I hadn't had that, it would have been very difficult. And I just want you to know that I understand. The two things that came out of that were, one, the financial burden's very real. We have financial counselors, and one of the tips that I'll give you today is don't put all of your expenses on a credit card. A credit card percentage is much higher than calling whoever the provider is and asking for a payment plan. It's a little tip. The second thing is that the fatigue level is overwhelming. I could not believe, I told patients about the fatigue, I just couldn't believe the fatigue level I was experiencing. It is incapacitating at times, and it's not something that a nap brings you back from. But I am to the place where I'm getting to be on the other side. My vision for you is hope. That through this group, this organization, through each other, through the support people in your lives, and I hope and pray for your team to support you as well, you can walk away from this experience and you can garnish something encouraging to give to somebody else. I want to thank you for being here today. My cards are on the table. If there's ever anything I can do, you can contact me or contact me through Peggy. And I just want to thank you, survivors, caregivers. You, in my book, are heroes. Thank you.
Open for questions. Questions, if anybody has
Anybody
any?
have questions?
You covered it, girl.
Sure. Go ahead.
I love what you're doing. I think it's great, and it's just too bad that as great a navigator as you are, like you said, there's navigators out there that aren't on your level. And I would hope that you could spread the word to other navigators throughout the country. Because anybody in this room would tell you, it seems to me that the medical system is so disjointed. You know, I mean, it's great here and not so great there. It shouldn't be like that. It should be even all the way around. And so I would hope you could, you know, spread the word, because what you were saying, what you're giving these patients, a lot of us never got.
Yeah, and I appreciate that. So Brett had asked me to, what would my wish list be going forward? Certainly my wish list would be for nurse navigators to be credentialed. There are several credentialing organizations now that do credential nurse navigators, and I hope that as they learn the foundation and the reason for nurse navigation, they begin to give out what they need. Melissa's going to speak a little bit later. Melissa did not have what we offer. She went to St. Elsewhere. But we opened up our breast cancer support group for women. We hopefully will have something local for men, and we brought her into our midst. And I hope that there are other organizations that will open up their support groups and things like that for other people. In addition, we just had Brett speak, tell his story. It was very impressive to many of our providers. Dr. Lopa spoke, and like I said, Murphy Houston spoke. On our evaluations, people said more of this, more of this, more of this. We are going to try to get into the high schools. Colon cancer is on the rise as male breast cancer is. And kids don't take care of their bodies. They don't recognize that when things are wrong, they need to tell someone. So we're going to try that as well. So I'm open to suggestions. I have a passion for this. I've had women, and not men yet, and I will tell you, it's hard as a woman navigator to get the trust for them to come in and really understand that I have for them what they may need on their journey. But I have had women come in, they'll run into my office, shut the door, grab a box of Kleenex and just sob. And I'll look and I'll say, do you need me, or is this just a safe place? And it all depends. But I also think part of a nurse navigator has to be that compassion. And is that a learned thing, or is that a DNA thing? I think by going through breast cancer, by knowing somebody, and I'd say in this room, everybody now knows somebody with breast cancer, that hopefully that sensitizes us enough to be there and to be present when people are in need. So.
All I can say is, as Brett's caregiver at the time we went through this, without our nurse navigator, as a mom, I'd have gone crazy. She'd answer texts, everything at any given time of the day to get us some answers. Because again, even the doctors didn't know how to treat Brett at the time because of his age. So, God bless our angels and nurse navigators, and give them a hand.
I'll be here all day too, so.
Go ahead, are there other questions? Go
Yeah,
on.
there are a couple in the
Go
back,
ahead.
is that right?
Go
Oh,
on.
sure.
You got
Go,
one.
I saw you.
Renee, when in your system, how connected are you with the patient, and at what point do you hand them off? Because I will tell you, the first day I got my diagnosis, I had a call from my nurse navigator
Yeah.
within 2 hours. And she was my best friend for, a month, and then I lost her, right?
Yeah.
And I got handed
Yeah.
over to the oncologist and the surgeon, and I don't know if that's normal. Is that standard? Because, I keep telling myself, I've got to go back now that I'm on the other side of this
Yeah.
and just thank her. Because a lot of people in this room know, right after I was diagnosed, my daughter got checked and she was diagnosed.
Okay,
So I was able
Yeah.
to call this, here's your navigator,
Yeah.
here's your surgeon.
Wow.
You
Yeah.
know, so that, so she's now impacted my family twice.
wow.
And so is that standard that you, once they get in with an oncologist, you pass them off? And in your world, what's a good form of appreciation back? Because I was not right-minded when we were talking, and I would love to circle back, and what's an appropriate way to
Right.
do that?
Oh, I love that question, and she would love it. Let me just tell you, just a thank you, and to see patients who are gone on to live their lives is amazing. So, I once said to my boss, I feel like I'm a bookend in people's lives. I'm there at the beginning at a crucial part, and one of the things you need to know is it's a federal law to release results to the patient when they're available. It makes it difficult as a nurse navigator because you're always trying to get there before that result comes to the patient portal. It's your choice. You can read it yourself, but it's nice to have read it and have a call right away. Right? That's my goal. But I think what happens is that when we pass them off to the surgeon's office, anything that you have regarding surgery needs to be with the expert in that field. It's the same thing with the medical oncologists, the experts in the field. There are nurse practitioners, there are physician assistants, there are medical assistants. It is a complex health system we have, fragmented at best, right? But I would guarantee you, your nurse navigator would appreciate a call anytime. I have a funny little saying to the partners who come in with their patients, and I say, you remember the Ghostbusters? Who you gonna call? Who you gonna call? I said, you keep that in the back of your mind, and anytime one of the patients says, who am I gonna call? You say, oh, Renee said that. You call the nurse navigator. And so we stay in our lane, but I wanna make sure that you know that we're available to you as you need. So good question. And, a thank you note. Sometimes people have DAISY awards where you can plug into a QR code, and you can actually tell somebody in administration how much you appreciate them. That's helpful too.
Thank
Thank
you,
you.
Renee, we appreciate